Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medical. Today I am going to discuss about the varicocele. Varicocele is a condition of varicosity of the cremastic and the testicular veins. Description: Pampiniform plexus. The veins and the epididymis form an anastomosing plexus and is the bulky part of the spermatic cord. As the veins pass through the inguinal canal, become reduced in number to 4 to 8. Coalescence in the neighborhood of the internal inguinal ring brings about further reduction in their number. By the time they reach the posterior inguinal ring, a single or a duplicated testicular vein pursues its cephalad course behind the peritoneum to empty into the renal vein on the left and inferior vena cava on the right side. The testicular veins have valves at their termination only or may be absent. In that case, the valves may be present nearby in the renal veins. The cremastic veins anastomose with the testicular veins and providing alternative venous return, draining mainly into inferior epigastric vein. Clinical features: It is common in hot climates and tall people. Pain. Sometimes dragging pain may be present on the affected side. The course of the pain is that of the elongated scrotum. Don't support the testes and full weight is borne by the cord. The left scrotum on palpation with the patient standing, varicose plexus feels like a bag of worms. Tension in the veins is low when held between fingers and thumb and patient bows. As impulse is felt when the patient coughs. In long-standing cases, the left testis is smaller and softer than the right due to atrophy. Infertility can be caused by varicose and spermatogenesis. The testis in the scrotum is supported by cremaster and dartos muscle. The function of the cremaster is defense by retraction upwards. Dartos bears the weight of the testis and is reflexly controlled by temperature changes and acts as a thermostat for spermatogenesis. On exposure to cold, it rises the testis to the body, so conserving heat, while a too warm environment causes relaxation of dartos. Treatment. The treatment of choice is the operation and indicated only when there is pain or depression of spermatogenesis causing oligospermia. Technique of surgery. The operation table is tilted downwards to distend the varicosities. Scrotal incision is made and testis and varices are exposed. Tortuous and varicose veins are divided and ligated individually. If there are any distended testicular veins of pampiniform plexus, the enclosing grenissing capsule is incised and each affected vein is incised and ligated. Sufficient veins must be left to maintain venous rhythm. Hematoma formation after operation on the scrotal contents is usually due to bleeding from the dartos muscle. This should be sutured meticulously with a continuous everting catgut stitch. The scrotum should not be drained. The skin edges will lie together and need not be stitched. The scrotum should be supported on a bridge of elastoplast across the thighs, and the patient should be kept in bed for 48 hours. As a result of this operation, the testis becomes fuller and dartos contracts, supports the testis and relieves pain. Oligospermia cases show a improvement of 75%. Conception improves by 30%. That is all about the varicose veins. And in the next video I will discuss about some other disease. Thank you.